You wake up and something is wrong. Your throat feels tight. Your skin is hot to the touch, hotter than it should be. There's a wound on your leg from 3 days ago, a cut that seemed small at the time. And now the skin around it is puffy and dark red, spreading a little further every hour. You have no idea what any of this means. You just know it's getting worse. There's no clinic to walk into, no pharmacy shelf, no one to tell you the name of what's happening inside your body. The only people around you are the same 20 or 30 people you've hunted, walked, and slept beside your whole life. And none of them have any more answers than you do. Whatever happens next happens here, with whatever the group already knows and whatever they're willing to try.
Today, if you cut your leg like that, you clean it, maybe grab an antibiotic ointment, and forget about it by the weekend. If a fever spikes, you take something from a bottle with a label written by people who tested it for years before it ever reached you. But for most of human history, getting sick wasn't an inconvenience you managed. It was one of the most dangerous things that could happen to you, and it happened constantly, with absolutely no guarantee of an answer. The first danger is infection itself. A wound that would be a minor annoyance today could become a death sentence, with no way to clean it properly, no way to know when it had turned dangerous, and no way to stop it once it had. The second danger is misdiagnosis, except there was no diagnosis to get wrong in the first place. Two completely different illnesses could look identical from the outside, and treating the wrong one or treating it the wrong way could make things worse instead of better. The third danger is spread. In a small, close-knit group sharing food, shelter, and warmth, a contagious illness didn't stay with one person for long. It moved through everyone, and there was no such thing as quarantine when survival already depended on staying close together.
Here's where it gets interesting. Despite all of that, the archaeological record shows something surprising. Ancient humans weren't just guessing helplessly. They were actively practicing medicine, and some of it was more advanced than most people assume. One of the clearest examples is trepanation, the practice of drilling or scraping a hole into the skull, and it goes back much further than most people expect. Skulls with healed trepanation wounds have been found at sites across Europe, dating back at least 7,000 years, and some specimens are considerably older. The key detail is the word healed. The bone shows signs of regrowth around the opening, which means the person survived the procedure, sometimes for years afterward. Nobody fully agrees on why they did it, whether it was meant to relieve pressure from head injuries, treat seizures, or address something more ritual in nature. But the survival rate itself tells you something important. These were not random, botched attempts. Someone understood enough about the skull to do this safely, more often than you'd expect from pure luck.
Then there's the discovery that really shifts the picture, a find known as Shanidar 1, a Neanderthal skeleton discovered in a cave in Iraq. This individual had suffered a crushing injury to one arm early in life, likely lost the use of an eye, and showed signs of significant hearing loss. And yet the bones show this person lived for years, possibly decades after those injuries. A Neanderthal with those disabilities could not have hunted, could not have fully defended themselves, and almost certainly could not have survived alone. Someone fed this person. Someone protected them. Someone chose to keep them alive long after they stopped being useful in any practical survival sense. That single skeleton quietly rewrites what we assume about how ancient groups treated the sick and disabled among them.
Herbal medicine goes back just as far, and the evidence is oddly specific. At Shanidar Cave, the same site as that Neanderthal skeleton, researchers found pollen from several plants with known medicinal properties clustered around a burial. Plants still used in some traditional medicine today for their anti-inflammatory and antimicrobial effects. The original interpretation was that this was a deliberate burial ritual involving medicinal flowers. Later research complicated that story, suggesting some of the pollen may have been introduced by burrowing rodents rather than humans. But even the more cautious interpretation doesn't erase the wider picture. because plant residue on Neanderthal teeth at other sites has independently confirmed that they were consuming medicinal plants, including some with pain-killing properties, on purpose. Wound care itself had its own quiet sophistication. Ancient Egyptian medical texts describe dressing wounds with honey, and honey genuinely works as a wound treatment. It's naturally acidic, low in moisture, and produces hydrogen peroxide as it breaks down, all of which make it inhospitable to many types of bacteria. Modern medicine actually still uses medical-grade honey in specialized wound dressings today, which means a treatment first written down thousands of years ago never entirely stopped being useful. And the trepanation numbers get even stranger when you compare them across time. Some studies of skulls from pre-Columbian Peru found survival rates for trepanation surgery as high as 70 to 80% in certain periods, compared to survival rates for skull surgery during the American Civil War, thousands of years later, that were often worse. Somewhere along the way, in specific places and specific eras, ancient surgeons were quietly outperforming doctors operating with far more theoretical knowledge, but far worse practical hygiene. Bone tools clearly used for medical purposes start appearing in later periods, too. Tools shaped specifically for setting fractures, for scraping wounds clean, for extracting problem teeth. And speaking of teeth, one of the more uncomfortable discoveries in this whole field comes from a 14,000-year-old skeleton in Italy, where researchers found a tooth with clear evidence of having been deliberately drilled and scraped to remove decayed material, essentially an early dental filling procedure, thousands of years before anything resembling modern dentistry. There's also the case of Otzi the Iceman, the roughly 5,300-year-old frozen mummy found in the Alps, who keeps showing up in these stories, for good reason, because his body is one of the most complete windows we have into how seriously ancient people took their own health. Otzi had 61 tattoos, and unlike most tattoo traditions built around decoration or status, his were placed almost entirely over joints known to suffer from arthritis, areas where researchers later found genuine degenerative damage in his bones. Many scientists now believe these weren't decorative at all. They were a form of therapeutic marking, something close to an ancient version of acupuncture, applied directly to the places that actually hurt. He was also carrying two different types of fungus in his gear. One, tinder fungus, was for starting fires. The other, birch fungus, has natural antibacterial and antiparasitic properties, and researchers found he was infested with whipworm, a parasite that fungus is known to help against. He wasn't just carrying supplies, he was carrying medicine, and he seems to have known exactly what it was for. Prosthetics tell a similar story of quiet ingenuity. In Egypt, archaeologists discovered an artificial big toe, now called the Cairo toe, dated to around 950 BC, carved from wood and leather with visible signs of wear, consistent with actual use for walking, not just for burial appearance. It even had multiple hinge points built in to flex naturally with the foot. Later, in the Roman world, archaeologists found a bronze and wood prosthetic leg dating back roughly 2,300 years, belonging to someone who had lost a limb and clearly kept living an active life afterward, supported by a device built specifically to let them keep moving through the world like everyone else. Now, here's the part nobody really talks about. A lot of ancient medical knowledge wasn't stumbled into randomly. It came from decades, sometimes centuries of trial and error passed down specifically by people whose entire role in the group was healing. Every culture we have detailed records of had some version of this figure. A healer, a shaman, a medicine person, someone whose job was to know which plants helped and which ones killed, which wounds could be treated, and which meant it was time to prepare for the worst. In many hunter-gatherer societies studied by anthropologists, this knowledge wasn't casual. It was an apprenticeship, sometimes lasting years, where a healer trained a successor in exactly which bark reduced fever, which root stopped bleeding, which combination of plants was safe, and which was fatal in the wrong dose. Getting this wrong wasn't a minor mistake. It could kill the patient, or the healer's own reputation and role within the group. And it wasn't just plants and surgery.
Splinting broken bones with wood and hide wrapping shows up in the archaeological and ethnographic record across cultures with no contact with each other, which suggests it was independently discovered again and again, because the basic mechanical logic, stopping a bone from moving so it can heal straight, isn't hard to figure out once you're desperate enough to try.
In India, an ancient text called the Sushruta Samhita, compiled roughly 2,600 years ago and attributed to a physician named Sushruta, goes even further, describing detailed surgical procedures, including an early form of reconstructive nose surgery, using skin grafted from the patient's own cheek or forehead to rebuild a damaged nose. The text lists over 100 surgical instruments and describes procedures for cataract removal, wound suturing, and setting fractures, organized with a level of systematic detail that reads less like folklore and more like an actual medical manual. Surgeons trained under this system reportedly practiced their incision technique on things like fruit skins and dead animal tissue before ever touching a real patient, which is not so different from how surgical training still begins today. Egyptian medical texts, specifically a document called the Edwin Smith Papyrus, dated to around 1600 BC, but likely copied from a much older source, describe traumatic injuries and treatments with a level of clinical, almost modern detachment. It walks through case after case of wounds, examines the patient, states an assessment, and gives a treatment, or in some cases, honestly states that the case is untreatable. That kind of blunt medical honesty, admitting a wound was beyond saving rather than performing empty ritual, is strikingly close to how a modern doctor might triage a patient today.
So what did ancient humans actually do when someone got sick, with no doctor around? They didn't just watch and hope. They developed real, tested, transmitted medical knowledge, refined generation after generation by people whose entire purpose was keeping others alive. They performed surgery on the human skull and had patients survive it. They cared for the disabled and the injured long after those people could contribute to the group's survival, purely because keeping them alive mattered. They used plants with genuine pharmacological effects, passed the knowledge down through dedicated healers, and documented their failures as honestly as their successes. And the next time you take something from a pharmacy shelf without a second thought, remember that the entire idea of treating illness with intention, rather than simply accepting it as fate, is something humans had to build from absolutely nothing. One healed skull, one surviving patient, one carefully guarded piece of knowledge at a time. They didn't know what a virus was. They didn't know what bacteria were. But they knew enough to keep each other alive far more often than you'd expect. And that quiet, stubborn refusal to let each other die without a fight might be one of the oldest and most human things we've ever done.
If you enjoy these kind of videos, leave a like, don't forget to subscribe, and hit that notification bell to keep you updated. See you next time!